Well, right now, doctors and nurses are being asked to work more hours. Family clinics are needed to stay open later. And overflow ERs are being opened as hospitals across the country grapple with a capacity crisis. It's a situation which could only get worse as we head deeper into flu season. Infectious diseases specialist Dr. Lisa Barrett is joining us from Halifax this morning. Good morning.
Good morning.
Let's start with where you are, Dr. Barrett. Provincial reporting in Nova Scotia last week showed that 17 of the province's 36 hospitals were operating above 100% capacity. The highest in Fisherman's Memorial, that operates at 183% capacity. Doctor, what does that even look like on the floor?
Well, it means that, of course, emergency rooms are very, very full to over full, that they're making beds in places where there usually are no rooms, so there's no walls, and there are people in places you wouldn't normally expect getting care. I think folks are doing the best they can in those kind of situations, but it's very, very difficult to look after way more people than you would expect in a hospital that's used to process and knowing where people are, knowing where their charts are, knowing where their medications are. It just creates a very, very challenging situation to give good care, let alone sufficient care.
Yeah, I mean, you couple that with staffing shortages, and, you know, we understand why this situation is in crisis. What's driving the increased move to hospitals?
Well, I think it's different in every specific hospital, but the global themes across our country are that you're very correct. There aren't a lot of people to care for additional sick people being sick all at once. We have viruses that have come together so far. COVID, unfortunately, isn't a seasonal virus yet. It's still around and hasn't gone away. Flu is on its way up. And, of course, RSV, or respiratory syncytial virus, in younger kids and to be honest, in some oldest adults, is a problem that's bringing people to hospital. And the system didn't have any give before any of this. Mm-hmm. That's the challenge. You put those three things together, along with the fact that we've had 2 years of people now showing up for their health care, needing to get cared for, and it's a very, very challenging situation. Any parts of this that we can reduce the stress or who needs to come to hospital is very important. Staying healthier is very important.
Can we sustain this kind of crisis much longer? I keep going back to what an emergency room doctor in London said to me when I said, "What's the fix here?" And he said, "Don't get sick."
I mean, he's correct. Can we sustain things? I mean, the challenge is, I think sometimes people don't understand in the public what strain means. And I think it's good to ask your health authorities, your governments, what does this look like? Are there people who aren't getting cared for? Hospital systems are excellent at triage. The very, very sickest will almost always get looked after. It's the people in the middle zone who get left behind, who aren't, you know, in a life-threatening situation in the next 20 minutes. And I think go back and ask people what that strain means. It means a lot of Canadians out there are going to have to wait for health care. And that doctor was right. We can't keep doing that to people if we expect them to be healthy in the long run. And he's right. If there's a situation like a virus you can avoid, pick your favorite virus, respiratory virus, and you can avoid it and do some things to avoid it and reduce your chances of going to hospital. Now would be an excellent time to do it. It's not quite too late, and certainly to your point, we can't keep doing that.
Yeah, Ontario has recommended masking in public settings. Do we need to see more restrictions or mandates come in place again just to try and take care of this crisis? Because the fixes are coming on the back of healthcare workers, and there's not enough of them. There's more sick people than there are people to take care of them.
Well, and it's not just health. I mean, let's be clear. People are, you know, every year people die of respiratory viruses. No one expects that to go to zero. But there's certainly a lot of people out there that are very unwell with respiratory viruses that can't handle them. And, you know, we're really not doing them any favors at the moment, especially with stressed health systems. So what we need to do is reduce the number of people that are getting sick. This is not rocket science at this point. Mandates are tough, and we don't know that they work. I can promise you communities are going to have to start taking leadership around asking for people to not be there when they're sick, actively asking people to wear masks, and being confident that that's the right thing to do. There's a lot of talk out there at the moment about what masks mean. This is not a COVID-19 problem. This is a respiratory health problem for this fall that's going to allow us to still look after people with other medical problems, with heart attacks, with other issues. So this is not a COVID-19 problem anymore. It's a respiratory health issue.
Dr. Barrett, we're going to have to leave it there. I know it is a busy time for you, especially where you're working this morning in Nova Scotia. Thanks for joining us.
Thank you. Take care.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.